6-year-old Chanel Koki is suffering from Blount's disease, a growth disorder that affects the bones of the lower leg, causing them to bow outwards.
So akafanyiwa surgery.
However, according to Koki's mother, Susan Muli, she was not born this way.
Oh, she was born normal. I don't know what happened along the way. She started developing things that looked like rickets. But hakuwa na rickets all along because venye walimwangalia walisema it's just a normal it's a deformity that ilianza hivyo. Yeah, so when nikampeleka PDK in Westlands, so we were given night supports that I was supposed to be placing them on the knees, na mfungo usiku this side and this side on both legs, but with time ikakataa zimekuwa too much.
Having tried various hospitals, Susan was finally referred to the AIC Kijabe Cure Clinic, which she found assistance, and although challenges still persist, she says things are getting better by the day.
Pia mwenyewe amekuwa, what can I say, she's outgoing. Since she's back in school. Yeah. So the only problem naweza sema ni setbacks za each time ako usi, wengine wako shule. That's all I can say. Yeah, but akisha recover, she will be going back to school. Mwambie hi. Hi. Yeah.
Thank you. AIC Kijabe Cure Clinic provides prosthesis, spinal surgery, total hip and joint replacement, even sports medicine, in a bid to ensure that such specialized medical services need not be sought abroad.
Kenya has moved from those days whereby we used to refer every kind of conditions to either South Africa or India. I know the government actually is equipping most of the hospital to become referral hospital for specific conditions. And our hospital is specializing on pediatric and sports medicines for adult and spinal injuries. So you don't have to refer your patient either to India or South Africa for this kind of conditions.
The clinic currently hosts a group of 25 doctors from various universities globally who are on a mission to train their counterparts in Kenya on the latest trends in the treatment of persons living with disability. Dr. Joseph Masharia, an orthopedic surgeon at Kijabe Hospital, says that according to research done in Kenya, only 60 to 80 doctors are trained for special treatment of people living with disability, and only 5 to 6 are able to treat those with physical deformities.
So we have some mobile clinics in very many areas of this country. And the reason for that is to be able to get the services closer to where the patients live. Our doctors are very experienced in this type of operations. And we usually would be able to provide that. We know that quite a lot of times people would go outside to look for care, maybe for joint replacement or for spine surgery or for injuries, sports injuries. But we have been able to provide that also. And that just shows that Kenya is growing in terms of specialized care to our population.
The Cure Clinic has also embarked on making artificial limbs, special shoes, among other items, in collaboration with local universities to make them easily accessible and affordable. Various setbacks face the medical fraternity in handling children living with disabilities, such as poor backgrounds, social challenges, especially in marginalized areas where parents with such children face stigma, mobility where medical facilities are far from homes, and lack of information, as few people know that they can receive specialized treatment right here in the country. Reporting for Channel 1 News, I am Melline Myendo.